A 30-year-old otherwise healthy woman in her last trimester of pregnancy is diagnosed with a right common femoral deep venous thrombosis. Which of the following is the best treatment option until delivery? A. Aspirin. B. Subcutaneous heparin. C. Subcutaneous low molecular weight heparin. D. Warfarin. And E. Inferior vena cava filter. The answer is C. Subcutaneous low molecular weight heparin. 11. A 65-year-old man undergoes a low anterior resection for rectal cancer. On the 5th day in hospital, his physical examination shows a temperature of 36.5 degrees centigrade, blood pressure of 130 by 80, pulse of 75, and regular and respiratory rate of 16 breaths per minute. His midline incision shows a localized area of erythema in induration. White blood cell count is 9,000. Which of the following is the best treatment option? A. Topical antibiotics alone. B. Intravenous antibiotics alone. C. Incision and drainage alone. D. Incision and drainage and topical antibiotics. And E. Incision and drainage and intravenous antibiotics. The answer is C. Incision and drainage alone. Question 12. A 62-year-old woman undergoes a pancreaticoduodenectomy for a pancreatic head cancer. A jejunostomy tube is placed to facilitate nutritional repletion as she is expected to have a prolonged recovery. Which of the following is a contraindication to enteral feeding via the jejunostomy tube? A. Delirium. B. Delayed gastric emptying. C. Acute pancreatitis. D. Pancreatic leak. And E. Ileus. The answer is E. Ileus. Number 13. A 71-year-old man develops dysphagia for both solids and liquids and weight loss of 60 pounds over the past 6 months. He undergoes endoscopy demonstrating a distal esophageal lesion and biopsies are consistent with squamous cell carcinoma. He is scheduled for neoadjuvant chemoradiation followed by an esophagectomy. Preoperatively, he is started on total parenteral nutrition. Given his severe malnutrition reflected by an albumin of less than 1, which of the following is most likely to be a concern initially in starting total parenteral nutrition in this patient? A. Hyperkalemia. B. Hypermagnesemia. C. Hypoglycemia. D. Hypophosphatemia. And E. Hypochloremia. The answer is D. Hypophosphatemia. Number 14. An elderly diabetic woman with chronic steroid-dependent bronchospasm has an ileocolectomy for a perforated cecum. She is taken to the ICU intubated and is maintained on broad-spectrum antibiotics and a rapid steroid taper. On post-operative day 2, she develops a fever of 39.2, hypotension, lethargy, and lab values remarkable for hypoglycemia and hyperkalemia. Which of the following is the most likely explanation for her deterioration? A. Sepsis. B. Hypovolemia. C. Adrenal insufficiency. D. Acute tubular necrosis. And E. Diabetic ketoacidosis. The answer is C. Adrenal insufficiency. Number 15. 10 days after an exploratory laparotomy and lysis of adhesions, a patient who previously underwent a low anterior resection for rectal cancer followed by post-operative chemoradiation is noted to have succus draining from the wound. She appears to have adequate source control. She is afebrile with a normal WBC. The output from the fistula is approximately 150 cc per day. Which of the following factors is most likely to prevent closure of the enterocutaneous fistula? The answer is A. Previous radiation. 16. A 26-year-old man is resuscitated with packed RBCs following a motor vehicle collision complicated by a fractured pelvis and resultant hemorrhage. A few hours later, the patient becomes hypotensive with a normal CVP, oliguric and febrile. Upon examination, the patient is noted to have profuse oozing of blood from his intravenous sites. Which of the following is the most likely diagnosis? A. Hypovolemic shock. B. Acute adrenal insufficiency. C. Gram-negative bacteremia. D. Transfusion reaction. And E. Urethral obstruction. The answer is D. Transfusion reaction. Number 17. A 63-year-old man undergoes a partial gastrectomy with Billrod 2 reconstruction gastrojejunostomy for intractable peptic ulcer disease. He presents several months post-operatively with a megaloblastic anemia. Which of the following is the best treatment for this surgical complication? A. Packed red blood cell transfusion. B. Oral iron supplementation. C. Oral vitamin B12 supplementation. D. Intravenous vitamin B12 supplementation. And E. Oral folate supplementation. The answer is D. Intravenous vitamin B12 supplementation. Number 18. A 52-year-old woman undergoes a sigmoid resection with primary anastomosis for recurrent diverticulitis. She returns to the emergency room 10 days after with left flank pain and decreased urine output. Laboratory examination is significant for a white blood cell count of 20,000. She undergoes a CT scan that demonstrates new left hydronephrosis but no evidence of an intra-abdominal abscess. Which of the following is the best test to confirm the diagnosis? A. Urinalysis, B. Renal ultrasound, C. Intravenous pyelogram, D. Renal scintigraphy, and E. Cystoscopy. The answer is C. Intravenous pyelogram.